mid-facelift or lower blepharoplasty or cheek implants. I had 3 consultations with 3 well-reviewed, board-certified facial plastic surgeons on the topic of fixing my nasolabial folds and lower eye mid-cheek region. All 3 gave me 3 completely different recommendations: cheek implants, mid-facelift, and lower blepharoplasty. I am so confused. Filler was not on the table because of some bellophil I had 5 years ago, which makes some areas of my face look overfilled when I smile. Adding bad light pictures. Please help steer in a direction.
Thank you for your question. You submitted several photos with your question, and you describe the state of confusion you're in after going to 3 facial plastic surgeons and getting opinions about improving the area that involves the nasolabial fold. And essentially you were advised to have cheek implant, mid-facelift, and lower eyelid blepharoplasty. And you state your question as if it's one or the other for each individual choice. And certainly I could appreciate why you're confused as to what to do. It's also stated in your question that you had bellophil a few years ago, about 5 years earlier, and that you didn't like the result because it made your cheeks look too full when you smiled. Well, I can certainly share with you, based on the photos you submitted, my impressions of of what the issues are, and hopefully it'll give you some guidance that may or may not have been clear from all of the recommendations that were made. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. It's actually the specialty of oculofacial plastic surgery, which were amongst the first doctors to introduce mid-facelifting in the mid to late 90s. And so certainly helping this particular area has been a very big part of many different specialty practices. And I could certainly give you some ideas as to the thinking behind some of these recommendations. So to begin with, let's start with first the issue about the lower eyelid blepharoplasty, because I think that's fairly straightforward. When the one photo where your face is in kind of a 3/4 view, it appears that you have puffiness under your eyes. So I think that undergoing a lower eyelid blepharoplasty to help the puffiness is a separate issue and not one that would address the nasolabial fold. The lower eyelid puffiness being lower eyelid fat prolapse, I think from that perspective, lower eyelid blepharoplasty is a reasonable procedure. I would typically perform this procedure in what's called a transconjunctival approach, doing it from the inside of the eyelid to address the fat pockets to help the puffy areas. Now that comes to the question about cheek implants versus a mid-facelift. Well, certainly I think that one of the impressions that I think every doctor has been making about your appearance is that there appears to be a lack of projection of the mid-face. And so to one doctor, this is an opportunity to lift tissue, and to another doctor is an opportunity to restore volume. Now, understanding that from my perspective and with the experience that I have with the concept of mid-facelifting, I think that in your scenario, the mid-face has not dropped, and therefore I would respectfully disagree with the doctor who was recommending lifting. As far as the choice of a cheek implant, I can tell you that from, again, my impression from your appearance, that certainly mid-facial volume augmentation can be performed, and a cheek implant is certainly a reasonable option. I would also introduce you to another option, which may be a choice to make before moving forward with a procedure which is surgical in placement of an implant. And this procedure is called structural volumizing. Now, understanding that you had Bellafill placed in your cheek 5 years ago, the distinction that I would help you try to make is that the Bellafill was placed where typically most fillers are placed, whether it is a filler like Radiesse or a filler in the hyaluronic acid family of Restylane and Juvederm. It's placed in the soft tissue of the cheek. And it is a common complaint of people, especially those who have thin faces, when they get a filler placed in their cheek, which is well intended to add structure, it ends up hanging in the skin, and when you smile, it goes upward. Well, with structural volumizing, we're actually placing a long-lasting filler, such as a Juvederm Ultra Plus or Juvederm Voluma, at the level of the bone, where the structure needs enhancement. When it's placed at the bone level, the skin actually glides over the cheekbone, and therefore when you smile, the cheek doesn't look too full, but rather when you are relaxed, you look more balanced. Now, how is this beneficial to the nasolabial fold? Well, the nasolabial fold is not always sagging or deepened because of overlap, but rather it is a reflection oftentimes of the balance between the cheek projection and the lower third of the face. So a lot of times when we place volume in the cheek, the nasolabial fold doesn't look so deep. So this is more of like truly the art of balance and creating what is harmony in the facial appearance. So my approach to a situation like yours would be to consider doing a lower eyelid blepharoplasty and volume augmentation of the cheek with structural volumizing. This way you reduce the puffiness, which takes away from the tired look of the eyes, and improve the volume of the mid-face. Further, it's less invasive, and as far as the choice of cheek implant, I can tell you that certainly the healing time for a cheek implant and the stabilization of that appearance takes much longer than doing an injectable. When you do injectable like structural volumizing, people look pretty good immediately. And we see our patients in follow-up 2 weeks later. And further, for someone who has a relatively thin face and relatively thin skin, I should say, it is also important to try to do something where the skin doesn't show the outline of the implant. Now, generally speaking, that's not much of an issue when the implant is placed, but I caution people to understand that as you get older, the soft tissue and skin thins, and that issue can become problematic later on. Again, I would say that there's probably equivalent options of doing fillers compared to cheek implants, but I would say that reflective of my own practice, where patients want to have enhancement of the cheek area but often are averse to a facial implant, they love the idea of doing structural volumizing, especially when you're using a long-lasting filler, which can essentially be sculpted and placed very precisely in a way that I would argue is very different from placement of a facial implant. There is nuance and asymmetry in everyone's face that with injectables you can control much more readily and in real time without the confusion that occurs when there is swelling from anesthetic. So I think that this is another opinion that might be worthwhile considering in determining what is optimal for your facial appearance. I think that you are seeing what is truly the art of medicine, and that it is always going to be the case that doctors will look at the same patient with a different set of experience or different perspectives based on their own experience and their own aesthetics. And I think this is just why you can't think of anything as being a commodity or equivalence between doctors. And so I think that if you're not quite sure, get additional opinions. And I think that since it wasn't discussed with you by any of the doctors so far, the idea of lower eyelid blepharoplasty with structural volumizing is worth discussing with another doctor so you can get an additional opinion. So I hope that was helpful. I wish you the best of luck. Thank you for your question.